tuberculosis, and it remains the leading cause of death in the world. This despite billions being spent each year to fight the disease. Experts are now concerned that half of the world's 30 highest rates of TB are on the African continent, and the rate of reduction of tuberculosis in Africa falls short of global averages. According to the World Health Organizations, the African region is recording a 4% annual rate of decline in tuberculosis cases. What limits the continent in its efforts to reduce the TB burden? For more on this, I'm joined by Dr. Caroline Tatua from the WomenLift Health East Africa. Thank you very much for your time. And I'm wondering, as I was reading that intro, in terms of what inhibits Africa from efficiently dealing with tuberculosis would have been hampered anyway by the advent of COVID-19. Doc, let's start with that. The efforts that were made to fight tuberculosis and how those were distracted by the pandemic, and how we have started to recover, if at all, in our efforts to deal with tuberculosis efficiently on the continent.
Thank you very much, and it's good to be on the show. I said, my name is Caroline Tatua. I'm a health technical advisor with the International Rescue Committee, but I also am a cohort member for the WomenLift Health program, leadership program. So that's a really good question. I mean, despite all the investments that have been made, TB has still persisted, being a public health issue, and we know that despite the effort, there are certain issues, systemic issues that have continued to impact on our ability to really reduce TB. Things like poverty, which many people in Africa live in conditions where, poverty increases the risk of TB infection. We are overcrowding. We cannot, there's limited also access to proper diagnosis and treatment. Often there are costs associated with this. You did mention HIV and AIDS has been, really a major contributor to persistence of TB, because of reactivation of TB that was, quiet in people as the immunity goes down. People living with HIV, AIDS also have an increased risk of TB. And actually TB is one of the leading causes of death among people living with HIV. Then our health systems, and I'll talk about COVID-19 as you asked. Our health systems have, in many African countries have been weak. We are ill-equipped to deal with the burden of TB. We don't have enough healthcare workers. We don't have enough, diagnostic and treatment facilities. And with COVID-19, what we saw over the last 3 years was a really big shift of resources to testing, with the respiratory symptoms. Everybody, thinks about, COVID-19. We went into this response mode for COVID-19, and unfortunately, this took away, a lot of, resources for testing, for treating TB. And we know most people also were afraid to visit hospitals because of, the issues around, people that COVID may be, hospitals may be an epicenter for COVID, and, only people with COVID were going. A lot of health services we saw were really disrupted. So this also did increase the burden of, TB going undetected, people not coming to, for care, and, association of all, coughs and respiratory symptoms to equate to COVID. We missed out on a lot during that time. So people with chronic illnesses, including TB, really went undiagnosed and unmanaged during that time.
Yeah, and so as we deal now with the aftermath of the last 3 years and really the issues that were created by COVID-19, what kind of immediate interventions should governments be looking at to perhaps try and play catch up with some of the misses that we would have had when it comes to diagnosing and maintaining patients of TB?
Well, what we are seeing now, I mean, for example, COVID has been with us for quite a while, and right now we are getting some reinstatement of health services, almost to the norms pre-COVID. But I think there are, we need a critical, thought around the current strategies. Clearly, what we are doing has been, has gotten to us to some extent, but we need to change. There needs to be like a more serious consideration around, like approaches to TB interventions. One critical area that, and I think really, that really, hinges on what we can improve is improving like the gendered approaches, to TB interventions. We know that we need a multifaceted approach. We know that we need to promote policies that address the inequalities that really promote that impact on access to care. And unfortunately, women and children are particularly impacted. With policies that don't really look at the issues, the various social, cultural, stigma-related issues that impact the ability to access care. So I think governments, first and foremost, we need to relook at the whole policy and guidelines. Are they working for us? Are there specific needs and challenges that communities and especially men and women face that need to be taken into account in improving our TB national strategies and guidelines? How can we increase? Governments need to think about increasing access to treatment, to diagnosis and treatment, which is still, we still need a lot in that. Despite the interventions, many places don't have the capacities and capabilities. The health system cannot support the diagnosis and treatment efforts. We need to address issues around the burden of care, which again falls more or less on women. Women are primarily caretakers, and when family members have TB, for example, they themselves are at risk. They are the primary caretakers. They end up missing opportunities in terms of economic, earning, making some money to earn a living, and that kind of also continues to disempower them. So I think that's one area. Then we need to also look at TB holistically in terms of integrating TB care into very critical healthcare, like reproductive health services. Our reproductive health needs to be integrated into care and treatment. We know it impacts women and girls in terms of maternal health. It causes issues around challenges in pregnancy when a woman has TB. So we need to really look at those areas that have been left out, increase community, address the stigma that is associated with TB. People don't want to come out to test for TB because of its association with, HIV or the stigmatization. So people don't want to come out. We need to destigmatize TB as an illness like any other that, people need to recognize. When you have TB, you need to know where to get tested to confirm it's not TB. We need to ensure that they're able to get care. A lot also can be done around, as I said, enhancing the diagnostic capacity, ensuring that we have more testing centers. We have drugs. We've run out of TB drugs sometimes, and this has contributed a lot to a big issue we are facing now on multi-drug resistant TB, which is a real headache to treat. It's expensive to treat. It's more complicated to treat compared to the regular TB. And this is the burden Africa right now is facing. We've lost so many people to follow up, and they are not able to continue with their treatment. So I think there's a lot that needs to be done. And I think part of this is ensuring that we, as a governments, my word is to really, improve the gender equity in leadership, diversity in leadership, and ensuring that there's representation of many groups, that can really bring new thoughts, new ideas into our current, TB strategies. So just at the top of my head, that is something really critical for us to consider.
Absolutely. Thank you very much for those insights. That is WomenLift Health East Africa's Health Technical Advisor, Dr. Caroline Tatua, joining us this morning, speaking about the tuberculosis crisis that we look like we're seeming to be having, the medication inavailability, but also what governments need to do to make sure that those that are suffering are getting the adequate treatment that they need.